Now you're saying to yourself, well, I have falls and I have balance problems, but I don't have vertigo. Listen to Eric, and it's not vertigo. I'm not dizzy. And you think, well, there's no hope for you. But that's not true. Dorothy's here to tell us that falling and balance problems are not a normal part of aging, and she's going to help you learn what you can do to be safer and to keep independent.
Thank you. I'm Dorothy Villano. I'm a physical therapist at McLean. And like Freddie said, and Eric before her, balance problems can be worked on and rehabilitated so that falls don't have to be an inevitable consequence of aging. Just like when you have high blood pressure, you don't accept that as a part of life. You don't need to accept balance problems and falls as a normal part of your health. They're not normal, but they are common, like high blood pressure is. Even as many as 1 in 4 adults over age 65 fall. And when you get to age 70, as many as 1 in 2 people fall. So although, again, it's a common problem, it's not a normal effect of aging. And we want to be able to see people with these problems before they fall and try to improve their function so that they don't suffer a fall or a hip fracture.
So what does someone do if they're having these problems?
I think the first thing that I recommend to people is to have a screening with a physical therapist. Physical therapists are trained to assess individuals and talk to them about a fall that they may have had and try to dissect what may be the cause of that fall, and talk about function of that person's function through what we call screening tests. And those tests are general ways of just determining, is the person at increased risk for falls? So there are several types of screening tests that physical therapists perform. One of them is a questionnaire called the Activities Specific Balance Scale, or ABC scale, and it asks questions from as simple as, how confident are you in being able to get up from a chair without using your arms, to a higher level task like, can you walk in a mall? Can you walk on an icy sidewalk? So you can imagine that somebody may be more confident in walking around their home or getting up out of a chair without using their arms, but much less confident in walking in a crowded environment or stepping onto an escalator or onto an icy sidewalk. It turns out that people who have low confidence in their mobility skills and in their balance are actually at higher risk for falling. Another screening exam is the Dynamic Gait Index, and that's a simple test where we watch patients walk, and we ask them to turn their head from side to side, we ask them to look up and down, we ask them to stop and turn around quickly. Simple tasks like that sometimes present problems for people with balance problems. And as it turns out, that screening test can often pick up people with vestibular problems, and then we would refer them to Eric for further assessment of the cause of their vertigo. Because when they walk while turning their head side to side or up and down, what happens is we begin to see the gait deviate from a straight path, and people begin to lose their balance. And that gives us a sense in that screening exam, they may have a balance problem that's due to the vestibular system pathology. Another screening test that you can do at home, all you need is a simple chair, is to be able to see, can you get out of a chair how many times in 30 seconds, and time yourself. And you could try it and then ask a physical therapist, well, I was able to do it 10 times in 30 seconds. Is that normal for my age? And there are published studies that have identified what number of times you should be able to get out of a chair in 30 seconds without using your arms. So those are examples of screening tests that we employ to determine where is there a balance problem, is there an increased risk for falls, and perhaps is it, where does the problem begin? Is it a problem with strength? Is it a problem with the vestibular system? We have a general idea of what might be the problem.
And so now that you've had these screening tests and they indicate there is a problem and you're at a high risk for falling, what happens next?
So what happens next is intervention. It's very important to not just do nothing about these problems. Oftentimes people, like Eric was mentioning, when you have a vestibular problem, you start to decline in your activity level. You tend to want to stay home more. You tend to maybe hold on to furniture when you're walking in your house, and you think, well, as long as I don't fall, I'll be okay. And that's not okay. What we feel strongly about is getting to a physical therapist and having some kind of a a full evaluation of your balance function. And that can involve looking at leg strength, looking at range of motion of the legs and trunk. It can include and should include an assessment of, as Eric referred to, your somatosensory system. How well do you feel your hips and knees telling you where you are in space as you sway forward and backward and side to side? It can look at the vestibular system. It can also look at what impact vision has on your balance. So a full, thorough balance evaluation needs to look at the musculoskeletal system, the sensory system, and also coordination and how the neuromuscular system is involved in helping you balance. So how are your reaction times? Do you respond to falling backwards by having a normal balance reaction, or is it delayed, or is it not normal? Then we try to determine, well, what's next? What do we do in terms of exercise to try to address those problems that we identify in the evaluation?
So tell us more about the treatment program.
Well, the treatment program really depends on what we find out in the evaluation. If we find that someone has weakness in the legs, we may suggest to them, in addition to physical therapy, a home exercise program that works on leg strengthening. So it could be something as simple in your house as working on sitting down as slowly as you can without using your arms. Try to get up. Or maybe using your arms less and using your legs a lot more than you usually do. Many times we find people really rely on their arms to try to get out of a chair, and little by little that results in weakness in the legs and less use of the legs, and then poor balance. Oftentimes people move into homes where there are no more stairs, and they're very glad about that. They don't have to worry about climbing stairs. But then the problem is that they no longer can get up and down a curb, and they lose some strength in their legs, or just that ability to climb up a curb or a step. So the idea of just strengthening the legs using a simple aerobic step, and doing that in forward direction, sideways direction, stepping backwards and down, or forwards and down and backwards and up, to really work on leg strengthening. If the evaluation determines that there's a flexibility problem, maybe the ankle is really stiff, we're going to recommend stretches. We're going to help that person stretch out the ankle, the back of the calf, and all those muscles to make sure that they have the flexibility they need to perform balance strategies in an effective way. If the evaluation finds a vestibular problem, then we're going to, as Eric mentioned, incorporate activities that involve head turning, possibly looking at a visual target, and keep your balance while you're turning your head from side to side and keeping something in focus. Sometimes we even use the balance master that was mentioned before, and in the last few years we've incorporated the use of the Wii fitness system, and some fun balance exercises. Patients really love that. So there's a wide variety of exercise approaches, but they really have to be tailored to what your balance problem is and why you're having that balance problem. Sometimes it can be as simple as you haven't been as active in the last few years. Maybe you have a heart problem or a lung problem, and you've lost your endurance, your energy every day has declined, and you tend to sit a lot more. So a conditioning program and teaching you exercises for improving your endurance may help you indirectly improve your balance.
I know you're a big proponent of the poles, and so tell us more about why you're finding poles are so effective.
In the last few years, we've been working with people who want to get off their walker, use Nordic fitness poles for exercise and balance. And what we find is that when we want to get out of the parallel bars or off the walker, but we're still not ready to not hold on and balance, we can use these fitness poles, which people enjoy because it's kind of, it's just a little less, it looks like more fun than using a walker or parallel bars, and they'll hold the poles and work on their step-ups, but they've still got something to hold on to. But it's not as stable as a walker. So we'll use fitness poles for doing activities like step-ups or even walking to improve stride length. And it really tends to get people taking longer steps and slightly fast, and it improves their walking speed, which then in turn indirectly helps their balance. This something I didn't mention before is the ability to balance on compliant surfaces. Oftentimes people have trouble in balancing on carpeting, or if they want to walk outside on the grass. So we'll try to take them into those conditions and also work on surfaces that are very compliant, like this BOSU disc, and teach people how to shift their weight while they're on a surface that's not firm. And so that can be really challenging for people. And we start out with having them hold on and then gradually be able to let go and maybe stand on one leg on these compliant surfaces.
But you also have people using the poles just generally walking.
Yes, because in general, just for fitness, I have found that people who are overweight, who have arthritis, or who just aren't confident in walking outside but want to get back to a walking program, feel more confident in walking outside with these Nordic poles. And so we'll help people develop exercise programs that include walking with poles for 5 minutes at a time, 10 minutes at a time. And what we've seen is that people report losing weight when they start using Nordic poles because of the increased caloric expenditure that they experience when they walk with poles, similar to cross-country skiing. You exert more energy when you walk with the poles because of the arm motion than you would without the poles. So it can be.
It's 40% more calories.
Yeah, it's pretty significant. And when you have maybe arthritic knees or hips, just the pressure, being able to put pressure on the poles really can take away some of the pain in your joints and enable you to walk farther. Much like walking in the pool does because of the buoyancy of the water, which we also can recommend for people who have pain that may be impacting their walking and their balance.